Okay. Yep. So I got to ask an important question, like which is more important to you? Knowing why and what is causing your pain, or how to fix your pain. Okay, I ask one more time, which is more important to you, of top priority? Knowing why and what is causing your pain, as in your knee pain, your heel pain, your shin pain, or your ankle pain? Or Nelson, just tell me how to fix my pain today. I don't need to care why or what is causing my pain. So I'd like you to type in the chat group quickly. Do you choose why or how? So this is a very important question to help me to decide what kind of information I can share with you effectively to help you to understand how to treat a problem. Okay, so choose which one is your top priority. Both are important, obviously, but which one is more important to you? Is it the why and what is causing your pain, or how to fix my pain? Okay, good. Thank you for participating. Now, over my 23 years of fixing human being, from 6 to years old, youngest is 4 years old, the oldest is 96 years old, with all kinds of musculoskeletal pain, I have failed many, many times to discover some wisdom along the way. Meaning, in order to treat anybody pain successfully, we need to find out the why and what is causing your pain. Many clients come to Functional Training Institute, they cannot get their pain treated because whoever they see keep chasing the symptom of the problem. So that's why they cannot treat. They use the wrong solution as in the how to try to treat the problem. I give you an example, okay? I have an Indian client, he plays tennis regularly every week. He has a personal trainer, he trained for years. But each time the trainer asks him to do squat or he go and play tennis, his outer left knee will be pain and swelling, swell up. So he's very frustrated because he wants to lose weight, he wants to exercise, he wants to enjoy tennis with his friend, he can't. So after bouncing back and forth with many therapists, doctors, whatever visuals, eventually he came to me. Everybody was looking at his knee, but I was looking at his ankle and his hip. And intrinsically, all I did was using a massage ball to release his side buttock, which is the gluteus medius muscle. Once I released that muscle at the side bum for 2 minutes, the pain at the outer left knee went away. The swelling totally subsided. And he can play tennis, he can jump, he can squat, no issue anymore. So that's why I wanted to share with you, knowing why and what is causing the pain is important. That, oh, just keep looking at the knee, what's wrong with the knee? 99.9% of the time, it's never the knee. I always say the knee is the victim, never the source. The source is usually due to ankle mobility issue and hip mobility issue, okay, which I'll review to you layer by layer today. So hopefully my little short story of my client has started to get you thinking. Now, the next slide. Okay, a little bit about myself in case those of you who still don't know who I am. Just a 1 minute short video about myself. Okay, so I have been in the fitness industry for 23 years. Myself and my team of 13 trainers, we specialize in rehab, meaning fixing pain. and also peak performance training, meaning all kinds of peak performance from body transformation to golf specific, or very straightforward. We don't just treat pain, we also train for performance. Okay, there's 3 simple truths that can empower you to live pain-free actively. That's why you join this webinar, to know what is the 3 simple truths. Let me walk you through in the stages so you can totally understand why it's not difficult to treat whatever lower limb, as in hip, knee, ankle problem that you have. I call it the R4 bulletproof body system, even though it's the 3 simple truths. Now, the first one is called review your source of the pain, meaning when you come to Functional Training Institute, we actually review, meaning doing assessment, finding out the source of the pain, why and what is causing your pain. For example, we do movement dysfunction screening, ask you to do the basic squat to see how low you can squat down, at what range, left or right pain, whether the knee going inwards, which I'll show you some example in a while. We also do ergonomic assessment, meaning to find out your home lifestyle. How are you sitting on your chair? How are you lying on the bed, and whether you have a bolster in between your knees when you sleep, those kind of stuff for women with wider hips. We also look at your posture, whether you have flat foot or collapsed arch that is causing your feet to collapse inwards, thereby affecting your knee, which I'll show you some example in a while. And of course, under the review of the source of pain, we definitely look at your exercise history. Like, do you cycle during COVID? Do you do a lot of jumping stuff like jumping jet and all those things that is not suitable for your knee? Or do you do a lot of trampoline jump like my client who eventually developed knee pain? So that is under the first truth, which is review your source of pain, which is very crucial, because from knowing why and what is the cause of pain, you can definitely go to the second step, which is called release your cause of pain. Now, release your cause of pain, meaning we are trying to release the muscular and fascia tension in the body, pulling your joint, which is a skeleton. In this case, is your kneecap, out of position. Okay, that's why giving you pain, which I'll show you a video in a while to help you to understand better. Now, release can be done in many ways. In Functional Training Institute, we are very, very competent in doing self-myofascial trigger point release, known as the vibrating roller, or using hands-on release. So this Saturday, there's a live workshop, 2.5 hours on teaching you how to do the release using the vibrating roller. It's free for Saturday and Sunday. Normally I charge it, so please come in, only left a few slots. After this, you can register for it. Now, release can be done also via cupping. Michael Phelps, the swimmer, made cupping very popular. You can do release of your tension of your muscular and fascia tissue using cupping. You can use flossing using an elastic band wrapping around your joints. You can also do joint traction. Joint traction is usually more familiar for people who go to chiropractor to decompress the spine. In case you didn't know, joint traction can be done in many places. Can be your hip joint, your knee joint, your ankle joint, your shoulder joint, pretty much everywhere, even your fingers. So joint traction help. And finally, of course, stretching is also a form of release. Now, after you release your muscular tension, your joint will have less compression, your kneecap will be less misaligned, so you feel much better. Example, you go for massage, you feel better. But why the pain keep coming back? Because you need to go to the third step. The third secret or simple truth is so-called retrain your body alignment. In this case, is what we introduce integrated corrective exercise to retrain your lower limb, meaning to retrain your arch of the feet, retrain your knee alignment, retrain your hip, all the way from your spine, lower spine, mid spine, upper spine to your shoulder, elbow, and wrist. In that way, once you're aligned, you'll find that you will never have the pain keep coming back to bother you. Most people do not retrain, they jump straight to training what they want instead of what their body needs. Hence, they keep having the pain, which I'll show you more example of the video. You will get a very clear understanding of why you keep having the pain like some of our clients. Now, lastly is, of course, the result that you will love. Most people exercise because they want to achieve some result, be it normalizing their blood pressure, reducing their cholesterol, lose the fat, build the muscles that they want, increase the bone density, improve functional strength, mobility, improve sports performance, or simply de-stress. Now, I'm going to play you a short video on what is the R4 methodology the FTI clients go through, to let you have a glimpse of the video so that you know exactly what I'm talking about. Okay, so all the ladies that you saw in this video, they all has pain, all kinds of pain, from slip disc to knee pain to wrist surgery to knee surgery, all kinds of problems before they come to FTI. So after going through the 3 simple truth, review the source of pain, release the cause of pain, retrain the body element, you see then eventually training for results, which is what everybody wants eventually. Okay, very straightforward. Here I'm going to ask an important question that hopefully you have been following me so far to see whether you get the idea and concept which one is more important. Now, with so much money spent on health to restore your pain, meaning seeing chiropractor, rofer, acupuncture, and cupping, I believe some of you have tried one or many of them. Now, why are most people still chained with pain? All these professionals, they are good people trying to help you to live pain-free. However, after seeing them, you somehow still see the pain keep coming back. There must be a reason. So what I want you to do is make a guess and type in the chat group. Now, all these 4 wonderful people trying to help you, make a guess. Which R are they doing? Are they doing reviewing? Are they doing releasing? Or are they doing retraining to get the result you want? So I want all of you to take 30 seconds to type in the chat group, make a guess. Which R do you think they are doing exactly? Very good. Most of you got it correct. Thank you very much. Thank you for your participation. Exactly. They are doing the release. You have to understand release is only half the solution. Without retraining and without reviewing what is the source, the problem will keep coming back, like everybody has just gone through that process. Okay. Now, here's a very brilliant guy here called Thomas Edison, who invented the light bulb, of course. He came out this very famous prediction way back into the way back into the olden time. He mentioned that the doctor of the future will give no medicines, but will interest his patient in the care of the human frame, in diet, and in the causes and prevention of disease. Now, this guy is not only a brilliant scientist, he even predicted the future, saying that a lot of us will have pain. Now, let me break it down to you to understand why. And coincidentally, this prediction by Thomas Edison coincide with my R4 methodology, which I'm so excited about it. Okay, let me just break it down for you. So when he said taking care in the human frame, he was actually referring to the body alignment, very straightforward. When our body is aligned, we do not have pain. So meaning we need to align it by doing the review, find out what's wrong from your feet all the way to your top of the neck, why is it not aligned. Now, then you talk about diet, he's also referring to nutrition and hydration, which is also fall under R1 review. Nutrition means we have been eating a lot of processed food, causing a lot of pain and inflammation in our body. A lot of sugar in our body is causing inflammation. And also a lot of people these days are not drinking enough water. They're drinking a lot of other beverages like a soda, like a wine, all those kind of sugar drink like bubble tea and all those stuff, causing the body to be very dehydrated. So when the body is very dehydrated, the fascia tissue, the muscular tissue become a lot of adhesion, very tight. So very hard to slide when you move around. So hence you get a lot of noisy sound. Some of you say clicking knee. A lot of time it's not just taking the glucosamine, which I have tried taking glucosamine. My clients have take glucosamine to so-called improve the cartilage of the joint. It does not work because as long as there's not enough water in the body, your joint cannot be lubricated without water. That's why taking supplement does not work on its own. So hydration is the key to reduce inflammation and lubricate your joint. Definitely make your fascia and muscular tissue easier to move, okay? Less cramp as well. Now, when Thomas Edison talked about the causes, he's actually referring to the ergonomics and the hobbies, which also fall under review, the first R. So just now I already mentioned, right? What are the ergonomics that you do day to day? What are the hobbies that you pick up that's causing your joint to be misalignment? For example, right now you're sitting, joining my webinar. Look at yourself and be honest. Are you crossing your leg or are you sitting with both legs evenly parallel? Most of us will be sitting cross-legged, one leg crossing the other. or some of you even both leg is on the chair, both leg is not even touching the ground. So all this is causing a lot of unnecessary tension to your hip, to your knee, without you even realizing it, okay? And then he talked about the prevention of disease is actually referring to how to help yourself, which what we call release, which is R2 and R3. Release, doing self myofascial trigger point release, and retrain, doing the corrective exercise to realign your joint to prevent the disease, which is what kind of disease? He is definitely not talking about COVID virus. COVID can be deadly, but there's something even more, I would say long-term damage to you and go into depression as well, which is what we call the modern disease, okay, which is called a musculoskeletal pain, meaning modern disease due to life do good, we move less, we sit too much, we drive around, so we hardly move enough, hence a lot of our bodies start to have all kinds of musculoskeletal pain, meaning the disease that we have in the modern world, okay? Now, next slide, I'm going to talk about the common type of knee problem. Look at all these very fanciful names here: IT band syndrome, runner knee, chondromalacia, patellofemoral pain, arthritis knee. Some of you might belong to one of these category. Some of you say you have a clicking knee sound. I'm going to play this short video. Now, here is a very interesting. Please pay attention, because in this video, you will be surprised to see that not only the video explains what does the name means and what kind of problem will trigger what kind of pain, you will hear them suggesting a lot of solution to fix the problem. Now, I want you to pay attention, because later I will ask in the chat group, what solution do you pick up? Then I will explain why all these solutions do not work. Okay, I'll explain to you why, because all our clients have tried all these solutions, it does not work at all. I'll tell you why in a minute, but pay attention to this video first, okay? I'll ask you the question in a while.
Do you suffer from knee pain? It's important to pinpoint exactly where the pain is so you can find relief. Let's talk about the three most common types of knee pain: iliotibial band syndrome, or ITB, runner's knee, or chondromalacia and patellofemoral stress syndrome, and arthritis of the knee. If the pain is on the outside of your knee and runs up to your hip, you may have iliotibial band syndrome, or ITB. The iliotibial band is a fibrous band that extends from the hip to the knee and causes pain on the outside of the knee and may gradually move up the side of the thigh. You may feel a snapping sensation when you straighten your bent knee. Usually there's not a lot of swelling, and your range of motion in the knee joint should be normal. IT band problems can be caused by having high or low arches, having an uneven leg length, bowed legs, or weak thigh muscles, supination, where the feet turn outward and can cause friction and inflammation to the IT band, wearing shoes that may be worn down too much, running on uneven pavement or down hills, or a change in your normal workout routine. There are products from FootSmart and at-home exercises that can help relieve pain from IT band syndrome. At-home exercises like side stretches that keep the iliotibial band in range of motion, strengthening the quadriceps or thigh muscles, low-impact exercises such as riding a stationary bike or swimming. Products that can help: iliotibial band or stability brace, strengthening tape, cold therapy wrap, and supportive shoes. Now, let's discuss a second type of knee pain. If the pain is dull and around or under your kneecap, you could have runner's knee, also called chondromalacia or patellofemoral stress syndrome. Vigorous activities may cause excessive stress and wear on the cartilage of the kneecap. This can lead to inflammation and erosion, which can cause the cartilage to break down, making it difficult to move your knee. This condition most commonly appears in runners, but it can also affect those who participate in activities that require a lot of knee bending, like biking, jumping, even walking. Some of the factors that may contribute to runner's knee are flat feet, tight or weak thigh muscles, muscle imbalance, inadequate stretching, misalignment, overuse, or injury. There are products from FootSmart and at-home exercises that can help relieve pain from runner's knee. At-home exercises like stretching and strengthening the hamstrings, low-impact exercises that strengthen the quadriceps or thigh muscles. Products that can help: patella strap, compression sleeve or adjustable knee brace, shock-absorbing shoes, or cushioned insoles for support. The last type of knee pain is the most common: arthritis of the knee. Do you feel pain or weakness daily around your knee? If so, then you may have an arthritic knee, which develops after years of strain to the ligaments and tendons that support the kneecap. Arthritic knees can develop from daily activities that put pressure on the kneecap, such as kneeling, squatting, or climbing stairs. Weight gain also places stress on the knee. There are a few symptoms that may indicate you have an arthritic knee. For example, if your pain and swelling tends to be worse in the morning or after a period of inactivity, if you hear a cracking sound when you move, increased knee pain as the weather changes. There are products from FootSmart to help relieve the pain from arthritis of the knee: braces and supports, compression sleeves, warming therapy, topical analgesics. We recommend you consult your physician for a professional diagnosis if you think you may have one of these 3 knee conditions.
Okay, good. Thank you for your patience. I believe you have watched the video and saw a lot of recommendations. So I want you to type in the chat group now just one thing that you remember that can help the knee, what they suggest. Just one thing from the video that you watched. Please go ahead and type in the chat group. Just one thing. Everybody try to participate so I can know exactly whether you are paying attention. Thank you very much. Thank you, Cheryl. You mentioned exercise and good shoe. Mohammed mentioned stretching. Belina mentioned stretching. Anna mentioned stretching. Thank you. Elena mentioned light exercise. Kendra, hit pack. Very good. What else? Let's see what else can the rest pick up. Home stretching exercise and compression sleeve. Yes, compression sleeve. Exactly. Warming up exercise. Pauline. Did anybody? Okay, good shoe. Someone has mentioned good shoe. What about taping? Nobody mentioned taping. Insoles, yes, correct. Orthotic special customized insole. Okay, good. Now, I'll tell you my real truth from my 23 years experience, why so many clients spend so much money seeing so many people trying all these things that you saw in the video do not work. There's a reason why it do not work. I'll review to you, okay? Let me just get
Do you suffer from knee pain?
Okay. Now, you can see from here, under review, I'm talking about review, finding out why and what is causing your pain. I put here point number 1, can a good pair of shoes save you from knee pain? Answer is not really if your arch of the feet and your butt is not firing up. How about a pair of custom-made orthotics? Same thing, is not going to help you if your arch of the feet and the butt is not firing up, which I will prove to you by showing you some video about my client. What about taping, knee brace, whatever? And it's cycling. A lot of time people say, okay, I can't run. So because it's impact, I have knee pain. Let's try cycling. Let's try cross trainer, which is no impact. But do you know that if you are misaligned, you cycle, you wear out your kneecap even faster? Okay. I'm going to play another short video, which I purposely video it for you to watch about the kneecap. How does the kneecap move? So pay attention to this short video. It's very important and very easy to understand.
Hi everybody, this is Nelson here, founder of Functional Training Institute from Singapore, Regional Personal Trainer of the year 2021. Today I'm going to talk about why a lot of people suffering with knee pain, understanding the cause of your problem. Now, before I go to the knee model, let's take a look at the knee. A lot of people, when they walk, the knee start to cave in, what we call valgus knee. Or when they run, upon impact, the knee start to cave in. Or when they squat, they cave in. Or even when they lunge, they cave in. Or up and down the stairs, they cave in. Now, if you look at this knee model here, this is exactly like my right knee. This is the kneecap. This is the tibia bone, which is the shin, and this is the femur bone. Okay, under normal condition, when I bend my knee, okay, look at the knee model here as a close-up version. The kneecap is here. You can see the meniscus here, the lateral meniscus and the medial meniscus, which is a shock absorber. And you can see a groove here, very nice little groove here. We call the train track, and this is the train, which is the kneecap. So under normal condition, the kneecap can glide along the groove smoothly with no additional friction or pain. Same thing, the shock absorber of the meniscus can take the stress evenly and healthily. But when you deviate, like my knee, you cave in. What happens is due to the weakness of your arch and your side bump muscles, the arch collapse, the knee will cave in. The weakness in your glute medius and your glute max weak, you will cave in. So the kneecap will start to deviate outwards. So when you cave in, if you look at it, you'll see that the lateral meniscus will be compressed a lot more than the medial meniscus. And because of that, you still bend the knee many times a day. This will cause this lateral meniscus here to wear and tear much faster. You eventually, you wear off, you'll be bone on bone, giving you arthritis, inflammation, and pain. Same thing when you deviate outwards, you still bend the knee. The kneecap no longer sitting at the center of the train track. You start to deviate outwards like this, and you're still bending, creating a lot of friction on the kneecap. Bone on bone friction, eventually giving you bursitis, inflammation, and even arthritis. Hence, it is very crucial to keep your knee totally aligned at the center, meaning your kneecap aligned with your second and third toe for every movement, be it any direction, it has to be aligned. Okay? Now, if it's not aligned, it will definitely cause a lot of tension along your muscles, such as your lateral hamstring, your lateral calf muscles as well, even your IT band. So there, one simple exercise that can help to fix this is what I call a cowboy and soldier exercise using the mini band in the other video. So make sure you watch that video to learn how to track your patella, which is a kneecap aligned with your second and third toe. You'll be able to live pain-free actively with no more knee pain. See you soon.
Okay, I hope that short video has helped you to understand how the kneecap work in a very layman terms. And the exercise that I talk about, the cowboy and soldier, at the end of the webinar, I will show you, because that exercise that I created out of my desperation to help my client to prevent him and her from surgery, because my client has arthritic knee, worn out knee, booked the appointment for surgery. Both orthopedic surgeons say he has to go for surgery and already old, 70 years old. After releasing the tension and all those things, all I did was teaching him the cowboy and soldier exercise. The knee pain stabilized, no need to take any more painkiller, can sleep without pain, can go back to doing a lot of physical activity. Okay. Now I'm going to show you more example of why just now the video you watched much earlier, like I say, all the solution doesn't work. Now this is my daughter. She's 12 years old at the time when I took this picture. Now she's already 20 years old. Now, she is a very good runner, a very fast runner. So when the first time she participated in cross country, she came in first. I'm very proud as a father. But nevertheless, even though she's fastest runner, she came in first. But at 12 years old, she started to have knee pain. Can you imagine your children at 12 years old has knee pain, your child has knee pain? Obviously, the cartilage and meniscus is still very fresh and new. How can be a 12 years old human being has worn out cartilage and arthritic? It does not make sense. But why does she has knee pain? Thank you that I'm the father. So if you look at her feet and my feet, now you can see my right foot with the right red arrow pointing there. I have a bunion here. So I'm born structurally with bunion. Okay, I don't wear high heels. So cannot be I wear high heels and develop bunion. So since young, I have this bunion. Then I've been training barefoot. That's why I do not have knee pain. Now you look at my daughter, when she's only 12 years old, you can see a baby bunion exactly like me on the right foot. And you can see her right foot, the base is even wider, meaning her arch is more collapsed and not fully developed on the right leg. So every time she run and land, just like the video I showed you earlier, her knee will cave in, meaning collapse inwards. The kneecap will go outwards, giving her the pain because due to the friction rubbing against the muscles, the tendons, and whatsoever. So upon knowing that, I go through the R4 with her, reviewing what's the cause, get her a good pair of shoes, release the tension, retrain her butt and the arch. today she can still run very fast, and every year she was winning her cross country because she know how to release and retrain. So that is happening to a child. Now here's another important one, which is happening to my client's daughter, 13 and 14 years old. They are not even runner. My daughter is a runner. So, okay, you say runner run too much, they have knee pain. These two sisters is only 13 and 14 years old. The mom bring them to go to the park, to the stadium once a week, just to run leisurely for 3-4 rounds to sweat a little bit because they don't like to exercise. Now they are both wearing a very good pair of shoes called Asis Gel Kayanu, which is an anti-pronation shoe supposed to help you to stabilize your foot arch. This is a good shoe. I highly recommended it, but I want to make a point clear. They're both wearing a good pair of shoes, but why do they still have knee pain? Now, this is the video that I recorded. I want you to take a look, then you will see the answer right before your eyes. Because this can be you or your children or whoever. Now, if you see her running, she's running zigzag from left, then back to center, left, back to center. She can't even run straight. And you can see her both knee are knocking inwards. We call kissing knee. The kneecap are trying to kiss and overlap each other. Both knee has pain at 13 years old. Now I want you to make a guess. Which knee has more pain, the left or the right? Okay, I want you to type in the chat group now. Make a guess. Which of her knee has more pain, the left or the right? Both has pain. Which one? The answer is actually when the video stops playing, when the image is freeze. You can see very clearly her left knee is caving in more than the right. So meaning her left kneecap is shifting outwards, giving her more friction, giving her more pain. She's only 13 years old. Now you look at her sister, which is 14 years old, 1 year older than her, is the same issue. When she ran, same thing, she could not run straight, and you can see her kneecap slightly better than the younger sister, but nevertheless is still trying to overlap, and the kneecap is falling inwards. And her sister has one more issue, meaning her arm is swinging on one side, the other arm is not swinging at all. So this will also cause back pain and shoulder problem beside the knee pain, which can be easily treated, which I treated both of them. I'm going to show you a short video, image you can see here. Now you can see here, the bottom left picture here. Most of us wear footwear that is too narrow, squashing all our toes together, hence causing us to develop the bunion. You look at the picture on the right, this is the right kind of shoe we should be wearing with wide toe box, that our feet can spread apart evenly upon walking, running, jumping, etc. So under the X-ray, you can see very clear cut on the right side, the wide toe box shoe and the narrow toe box shoe, which a lot of people still didn't realize are wearing the wrong shoe their whole life. And the top row of pictures show you likewise, a neutral shoe versus a high heel or even a ballet dancer. You can see all the toes are being smashed together. Hence, a lot of ballet dancers had a lot of feet and ankle problems eventually by training very hard, okay? So I will skip this because I already mentioned, okay, I just play quickly for you to see when the knee cave in, the kneecap go outwards. Okay, very straightforward due to the weakness of the arch and the weakness of the side bump. Okay, some of you might have both knee caving in, some is one side depending on where your weakness or where your ankle issue. So usually it's always the ankle and the hip that is causing the problem, never the knee. Very rarely is the knee that I've been helping so many people over the years, okay? Let's go on. Now, here's another good example. Now, this lady is a marathon runner. She came and see me because she runs marathon every year. She still have knee pain. She's a good example that she wear a very good shoe called New Balance, which is also anti-pronation, meaning support the arch of the feet. And inside the shoe, she also wear a custom-made insole, which is even more expensive than the shoe itself. And because she's a very brilliant and bright woman, she loves to read. She bought a running magazine on how to strengthen her legs, join a gym membership, go to the gym 2-3 times a week to strengthen her thighs muscle, her butt muscle. After that, she still had knee pain. She could not understand why putting so much effort still had knee pain. So when she came and see me, I reviewed what was the problem, which I'm going to show you now immediately. So during the review, I asked her to do a two-legged squat. You can see during the squat, there's nothing abnormal. She can track her kneecap in line with her second toe. Now, the minute I asked her to transit to a single leg partial squat, you can see things start to change. She couldn't keep her knee at the center. Her kneecap start to deviate inwards. Her knee start to deviate inwards. The kneecap start to deviate outwards, causing a lot of stress to the knee. Same go to the other leg as well. Okay, very unstable. So this lady, Jasmine, asked me, okay, how does that relate to my running? She could not understand. So I put her on a treadmill and asked her to walk initially. Look at the video on the right now. So during walking, her kneecap is still apart, very nice, no friction, no nothing. The minute she start to go into a slow jog, you can see just like the two young sisters earlier, her kneecap totally overlapping each other every single step she land. Okay, meaning kissing knee, kneecap going outwards, the knee is going in, but the kneecap is going out, grinding and rubbing, causing a lot of unnecessary tension and pain. So conclusion, she was doing a lot of two-legged squat, meaning bilateral squat in the gym. She was not doing any single leg exercise to strengthen the outer butt and the foot arch. Hence, she didn't fix the pain, wasted a lot of time and money. So we managed to address that very quickly by finding out the source of the pain, why and what was causing the pain. Or the good shoe will only help if you train the muscles to support it. The shoe alone does not help, okay? Now then some of you will say, okay, Nelson, I don't run, I do cross trainer. So here's another powerful story that I want to share with you. Please take note. This is a cross trainer. This is my client. She trained with me functional training for years, never have pain, a beautiful mother, can jump, can squat, can up and down the stairs, single leg jump, never have issue. One day she left me because she went to US, migrated to US to accompany her daughter who's studying there. 1 year later, she came back on New Year Day to Singapore with 2 MRI report telling me that 2 orthopedic surgeons told her that she has to go to operate her knee. I was totally shocked. She can't even squat without knee pain, can't even climb the stairs without knee pain. She lost her mobility, I'm very shocked. So I asked her this question, what do you do when you went overseas in US? Do you continue my functional training? She said no, she totally stopped. I said, what do you do? She told me she used a cross trainer every day for 1 hour. Now, immediately I asked her to go on the cross trainer at my old gym. You see how she's using the cross trainer, you'll be shocked. Okay, you can see her using the cross trainer. Let me play one more time, it's a bit lagging. Yep. So you can see the way she used a cross trainer. Obviously, the kneecap is not in line with the toes at all. And she is wearing a good shoe again, which is called Esijau Kayanu. And secondly, her foot placement was off. You can see the left foot versus the right foot is totally different position. The right foot is further away from the pedal compared to the left. Hence, she's causing a lot of grinding on both knees. The right is worse than the left, plus the hip is tilting and not aligned, causing back pain as well. So upon knowing that, I obviously know why and what is causing her pain repeatedly with thousands of repetitions every day for 1 year. It is no surprise she wear her cartilage and meniscus and whatsoever. Now, immediately I went through the R4 with her, teach her how to release, teach her how to retrain. And within the same day, 2 hours later, we clean up the whole body, not just the leg, by the way, teach her how to put her placement. Her knee pain completely gone. She can squat, she can climb up and down the stair, which I tested her on the same day. And she looked at me in the eye and told me and asked me, Nelson, should I go for surgery? I said, when you go and see the doctor, look into the doctor's eye and ask him this question. Doctor, today, if you don't have any more pain, would you cut yourself? The answer is an obvious no. Why would you want to go under the knife when you no longer have knee pain and you found out the source of the pain? Even though your joint has degenerated or wear and tear, there are always ways to preserve it by waking up other weak muscle to realign it without going through the pain. The only time I will recommend you to go for surgery if you have a freak accident, like a skiing accident, you totally dislocate your knee, or you fractured your knee or your shin because of soccer, someone jam into your leg, you break your bone. Please go and see the surgeon and repair it straight away. There's no question about that. Okay, very straightforward. Okay, finally, we come to the bicycle. A lot of during COVID, a lot of people go into cycling. A lot of bicycle like Brompton bike is totally out of stock on waiting list, which is fine. I love cycling. I have nothing against cycling. I just want to highlight that when you cycle without the kneecap being tracked properly, which you can see on the picture on the left, it's the same thing again. Even cycling is no impact or so-called low impact. With not the proper knee alignment, wearing the cycling shoes, same thing, your feet are all cramped together, you only have more knee pain like a cross trainer. So it's very straightforward. You already know the answer. Okay, so make sure you align your knee, meaning you have to train your butt, your side butt muscles to fire up to align your knee with your toes. So when you cycle for leisure, for exercise, you do not have that problem. Now, last but not least, I want to share this amazing story with you. This is Teresa. You can see her profile. She's a mother of 46 years old. She loved exercise her whole life. She had lived in a few countries. Every country she goes, she has a personal trainer. She exercises 6 days a week. Now, however, even though she has a very beautiful body, very toned, very fit stamina with six-pack, she's still having pain on her knee and her both knee, which many people could not fix. So I'll play her short video quickly, her testimony video, to let you hear her inspiring story that how I fixed her knee pain that is even not related to the kneecap at all, okay? You'll be surprised. This is just one example that hopefully it inspire you and give you some hope that it can be fixed, okay?
Hi, I'm Teresa. I'm a fitness enthusiast who likes to work out 6 days a week. I enjoy a wide variety of exercises, ranging from strength training, HIIT exercises, running, yoga, Pilates, and recently I got a dog and he's super active, so I love to go for long walks and runs with him. 20 years ago, I injured my right knee from hyperextending it during my yoga practice. Since then, my right knee was never the same. Every time I go for my yoga, it will really hurt, especially on the long runs, high impact exercises, and also high intensity workouts. So I have seen many people over the years to try to resolve this, from physiotherapists, osteopaths, stretch clinics, and I even have like a personal trainer all this while to strengthen my knees, but none of them actually seem to give me a good permanent solution. What took a really terrible turn was in late 2020. I had 3 consecutive falls from my running as well as scootering. Since then, I could not bend my knees without feeling very tight. I could not squat properly. I could not run or walk properly. This has severely affected my daily activities, especially my yoga practice, which really saddens me. So after the fall, I tried increasing my strength training on my knees, as well as practice Pilates, hoping that it will help my knees. But though it helped a little, but the pain never go away. I was introduced to FTI by my Pilates teacher in September 2021. Initially, I was very skeptical because I've tried so many things. I took her advice and came to FTI and met up with the founder, Nelson. The unique R4 methodology was brilliant. The history of my injury, as well as what are my daily routines, my activity, as well as my diet. In review, we have discovered that I've collapsed arch from both my feet, then a tightness in my inner thigh, outer thigh, hamstring, as well as my glutes. My foot arches were weak, causing my glutes to switch off, which explained why my knees were in pain as from poor alignment. The FTY team taught me a series of muscle release using the vibrating roller as well as the neuro ball. After the release and a series of retrain exercises to activate my inhibited weak muscles on a daily basis, miraculously, the improvement on my right knee was amazing and swift. So my right knee was responding very well and no longer in pain in my daily activities. However, my left knee was not responding the same way. So we revisited the whole R4 process again, and this time we discovered that my right shoulder blade was sitting way too low, so causing an imbalance. That causes my spiral fascia line to be dysfunctional, giving me chronic left knee pain. Who would have thought that except for Nelson? To restore my right dysfunction shoulder alignment, we release the pecs, the lat alignment. We also tricep and also the rhomboids. And we train the serratus anterior, upper and lower traps, delts and the supraspinatus. And eureka! My left knee is all pain-free now. We then progress to functional strength and conditioning with proper biomechanics. After about 3 months, I was able to run again and started to perform some HIIT workout, which I was so thrilled about. Thank you FTI for all the effort and patience with me, which I'm very forever grateful for.
Okay, so I hope that you have get some insight from Teresa. We never always look at the knee because, like I said, the knee is always the innocent victim suffering silently with pain due to the dysfunction coming from the feet, the ankle, and the hip, or even the shoulder for Teresa K, which is crazy because I know about fascia lines and hence she met the right person. We could fix it quite fast. Okay.
Hi, I'm
Now, just now I promised to show you the retrain, even though we don't do in the webinar, but at least I want you to see this. A lot of people are doing the crab walk the side way using elastic band, which I've been doing for years until I hit the wall that why my client with knee pain after doing this does not help. Because they're doing in the frontal plane, meaning side way. You have to do in the transverse plane, which you see in this short video here. I'll play quickly to give you some idea, because some of you might be trainers here attending this webinar.
Everybody, this is Nelson here, founder of Functional Training Institute from Singapore, Regional Personal Trainer of the Year 2021. Today I'm going to share with you why you should stop doing this method of activating your glute medius, which is your side bump, to fix your knee pain. Now, when I first started as a trainer, like everybody else, I was so fascinated with this great exercise, doing this kind of side walk with the band, or doing forward walk with the band, hoping that this will always turn on your butt to prevent your knee from caving in, which eventually will fix your knee. But however, one day I hit the wall. No matter how much of this I do with my clients, there are some of them who can't really get the knee fixed. Why? Because in the day-to-day, when they were turning, they will still cave in the knee when they try to take something on the side. The minute they move the arm or the body, the knee will cave in. So the trick is, don't just do it in the frontal plane, meaning the side way. You need to do it in the transverse plane. I discovered by chance that doing in the transverse plane is much more effective by doing in the frontal plane with the side one. Let me show you exactly what I mean. I call it the cowboy and soldier exercise. So standing straight, behind can be a bench right behind you. So from here, you go into a 90-degree angle. This is my 12 o'clock. This is my 3 o'clock, this is my 9 o'clock. So from here, I'm going to go this, like a cowboy sitting on a horse, and come back, I'm going to close in. Okay? Like a cowboy sitting on a horse, I come back, I will close in. Okay? Now, watch carefully on my front leg here. You have to activate the arch of the feet while using your glute medius and your glute max to external rotate your hip so that your knee is in line with the second or the third toe. So this way, come up in a straight line again, sit and reach, stand and squeeze. Okay, same go to the other leg, sit and reach, stand and squeeze. Now the interesting thing is when I teach this to my client, the knee with the pain for my client usually was the one that has lack of hip control when I do this. Meaning when, for example, the client have this knee pain, when I ask them to move from left to right, they lose control and become this way, totally out of alignment. Whereas the better knee, they were able to control with the knee in line with the toe and come back up again. So try this movement. Now the other good tip is to, when they stand up, you have to activate the foot, the inner thigh, the pelvic floor, the abs, the butt, and the entire back by externally rotating your shoulder. So you sit and reach, you come up, you squeeze everything. You zip up from your feet to your inner thigh, your pelvic floor, your abs, your bum, and your back. All the 5 things to contract the muscles to improve your posture. So sit and reach, stand and squeeze the 5 muscles, sit and reach, stand and squeeze the 5 muscles. So stop doing just a side walk. Try this. You'll find out the dysfunction of your client, whether they have the control over the group medias and group max, which ultimately on a day-to-day, when they are moving at home, they will stop doing that because it's a transverse plane. They need to strengthen in the transverse plane. Okay? Thank you for watching this video.
Good. I hope you all get my point, because this simple but highly effective exercise can help all my clients, which I start to teach them from now, since months ago. Now I'm going to finish the webinar in just a couple of minutes. So pain is a part of life. Suffering is an option. These are my trainers. All my trainers can treat pain, and definitely can train for performance. We have a free 55 minutes consultation via Zoom or face-to-face for this month, which is ending soon, Sunday 31st, for anyone who has not visited Functional Training Institute. So my staff is going to send in the Google form. Let me check whether she has sent in the Google form. So you should receive a Google form link. Okay, Visha, can you send in the link now, Visha? Okay, yeah. So this Google form link is, you just need to fill up, take you less than 3 minutes. So fill up the Google form, give me some feedback, what you think about this webinar, what is one thing that you take away from this webinar, and also highlight in the Google form, what are the future workshops you'd like to attend that we can want to organize for you, or for your company, or for your organization, or for your club. We do that as well. And also don't forget that this Saturday and Sunday, we have the live workshop on knee pain, hip pain, and ankle pain going on, that is free for the public. It's 4 to 6:30. You can also register by contacting us using the same email and same WhatsApp number. So that then you can personally experience the review and the release process. Because today webinar, we don't have a vibrating roller with you, so we can't go through the release process. So do me a favor, fill up the Google form. If you give me some feedback, and if you want to do a live or Zoom consultation, we will hook up with you with one of our trainer if you haven't been to FTI before. Okay. Now I'll just hang around for a few minutes. Feel free to ask any question. I'll just hang around for the next 3 minutes. Thank you, Karen, for sharing that you've been through FTI and your trainer was Jack previously, and Jack has returned after he has rested from surgery. Yep, and you asked whether you can resolve your pain 100%. Definitely, for sure, because you went to FTI in November 2021. Now it's almost 9 months. We have evolved a lot of exercise and keep upgrading. So over the last 6 months, we have taken up many courses related to the knee. It's one of the course called Knee Over Toe Guide that we learned from the course. And we also have come up many interesting ways to further enhance, to realign the knee. I strongly encourage you to come back, Karen, that we can see you and help you to be pain-free again. Let me know whether you want to continue to see Jack if you're comfortable with, because all of us upgraded together anyway. So you can see any trainer. You prefer to see me first, you can always book an appointment with me to see me one time. Then after that, I can assess and treat you. After that, we can always go back to whichever trainer you feel comfortable, for sure. Okay, anyone has any problem, feel free to type in the chat group. If not, please submit the Google form. If you find it beneficial, give me some feedback. I'm always willing to learn along the way. Okay, feel free to ask any question about your own issue or whatsoever, if you feel comfortable sharing. Okay, I will just hang around for another minute or so. Now, if you find that this hour that you have invested with me is useful so far, can you please type yes, so that I know whether it is useful or you find it boring or whatever. Feel free, go ahead and tell me. Especially the video that I spent a lot of time to compile all the resources to let you see the how and the why, which take me years to compile, actually, to be honest. Okay, very good. Okay, some of you are asking for the recorded version. No problem. I have recorded today's webinar. We'll definitely send it out again to whoever who want to rewatch or whoever who want to so-called send to their friend to watch it because they have knee pain. Same thing after that, they can book the appointment. Okay. Very good. Most of you give me very good feedback. I truly appreciate it. And I also appreciate your precious time to be with me tonight. We'll conduct very regular webinar and live session in FTI. So feel free to spread around the words before I get very busy, travel around the world to teach again. So I'm trying my best to be in Singapore to share and help the Singaporean first before I start to travel. So spread the word around, come in for the live workshop, you will even appreciate more, and I can tell you even more powerful jokes to help you to retain very complex information, which is part of my specialty. And thank you for all of you who has voted me to win the Personal Trainer of the Year last year, which I truly appreciate it. Okay, so thank you for your time. I will receive your Google form and we will from there hook up with you to the right trainer according to the time and date that you want to come in and empower you to live pain-free actively. Okay, have a good evening. See you again. Thank you very much.